All right, good evening and welcome to today's webinar. I'm Danae Abear. I'm the Healthcare Innovation Supervisor with Well Ahead Louisiana. Thanks so much for joining us. As usual, your lines are muted to prevent background noise, but please feel free to enter questions into the Q&A box at any time during the presentation. Today is the 12th and final live webinar in our Telehealth and Practice webinar series presented by Dr. Ted Hudspeth. And today we are discussing special considerations in telemedicine. As with our previous sessions, the slides and the recording will be available on our website at walpen.org/telehealth. In addition to the live sessions, we have 4 pre-recorded on-demand sessions included in this series. The first on-demand session, Best Practices in Care and Communication, is currently available on our website, and the remaining 3 are in development and will be uploaded soon. As a reminder, the series is funded in part by the TxLaw Telehealth Resource Center, which is a HRSA-funded program at Texas Tech to provide technical assistance and resources to new and existing telehealth programs in Louisiana and Texas. And Well Ahead is partnered with TxLaw to serve as a support representative for Louisiana providers. And TxLaw is also part of the National Consortium of Telehealth Resource Centers, which allows us access to the resources from all the telehealth resources centers across the country. And with that, I will hand off to Dr. Hudspeth.
Hello, everyone. Welcome to our final live presentation, as Danae said. This has been an incredible journey for me, and I hope for you to be able to learn ways to implement your telemedicine program in your own practice. And that can be all the way from just simple monitoring of patients' vitals remotely to performing asynchronous visits, which is something that you can do in telemedicine and is considered telemedicine, to actually synchronous visits live like a FaceTime call with people face-to-face through your portal, being able to care for them. So we've included topics on all of that in our series here, and make sure that you go to the website and look for the ones that might be beneficial for you to help build the program that you're looking forward to having. So I'll start off with a quote here. Telemedicine, it allows us to connect a patient to a doctor, and it allows us to erase time and distance, which is really the miracle of telemedicine. I really liked this quote because we understand the distance thing, you know, doing a video visit with someone, but also the time thing. I've presented in some of these presentations on, you know, you can have asynchronous visits with patients, whether that be them sending in symptoms to you and you making an evaluation and management decision. That's considered a visit in today's world. Well, those are things that we have all done asynchronously forever in our primary care practices when we have managed problems with a phone note or an email or something like that. It's just that it's getting formalized now, and if done in an appropriate way, those are actually billable things, because as we've talked about before, if you're making an evaluation and a management, that is what we as providers are truly paid to do. And you just need to design it in a way that you can capture those types of things and be remunerated for your time and risk. So, but I love this quote because it really does envelop those concepts of time and distance. So we'll start off with a little bit of an overview. The special considerations, man, we could have gone any way with this. There are so many special considerations in telemedicine. What I wanted to focus on with this particular presentation, though, was trying to do what we said in that first quote. There are people who can't get into those things very easily. And there are special considerations for the elderly and for the pediatric patients and the hard of hearing patients. So there are some special things that you need to do to be able to allow them to transcend time and distance, to be able to get the care they need, you know, at the time that they need it. And I'm hopeful to be able to go through some of those special considerations with you today. For the elderly, we're going to look at some of the opportunities that we have, the challenges and the barriers that they have, and some of the accommodations that we can make to be able to make it a little easier for them. And then we'll look at a separate concept of ways that you can assist people to live in their homes as an elderly person with some assistive technologies that exist today. And those can be considered in the telemedicine world. And then some special considerations of caring for pediatric patients, both with well care and also some special type problems that children have that you can care for. I have some great tools in this presentation that I'll share with you. And then we have some pediatric telehealth guidelines. There's actually some great recommendations from a national consortium or organization that makes some great guidelines for some specific issues with children. And then going through physician attitudes about the challenges in dealing or performing a pediatric practice or caring for pediatric patients in their practice. And then I wanted to go through some special considerations for the deaf and hard of hearing folks, both with guidelines and accessibility requirements. So let's get started with the just a few statistics on elderly care. Between 2000 and 2050, the proportion of the world's population over 60 years of age will double from about 11% to 22%, and will increase from 605 million to over 2 billion people in that same period. Okay, that's huge. And the number of people aged over 80 will quadruple. So we really need to figure out a way to be able to get that population online with us and to be cared for online with us. Those are the people who need more care anyway. So it does behoove us to figure out those special considerations to help them. And some opportunities that we have with them, is that there has been a rapid increase in technology over the last few years, both in being able to diagnose and treat and track patients. So on the diagnostic end of it, we have better broadband in general now. We're able to have a decent video and see a decent picture of a person, or see what's going on and actually do some exam components. There are actually some technological pieces that you can use to listen to a heart and a lung, et cetera. So I've shown you some of those. And of course, the tracking pieces with the glucometers and the blood pressure machines, et cetera. So through that, we can also have improved monitoring. Chronic care is the real boom right now because of our aging population, and being able to monitor that over time and address abnormalities as they're occurring in real time is felt to be something that's going to help us care for patients better and be more cost effective over time. And of course, I mentioned the assistive independent living technologies that are going to be helping patients live in their homes or longer instead of going into assisted facilities, okay? And then, of course, our rapidly aging population, that is an opportunity for us to be able to do more of this, and the chronic care illnesses that we're going to have to be taken care of as this population grows. Of course, those folks are becoming more frail and need more assistance from us. So as far as the challenges, a lot of folks who are elderly are sometimes a little more resistant to the new technology. And really, I find that it is because of a fear that they just can't do it. A lot of what I've seen is that when we comfort a patient, again, we look them in the eye and tell them with all honesty, I will carry you through this process. And really, it's my nurses who do that. I mean, we kind of have a team thing about us trying to make people comfortable with it. And I think, no one wants to be seen as not knowing how to do something. If we're there to help them understand, we will help them every step of the way, then they usually will take the ride with us, okay? So another thing that this age group often has is concerns about privacy. They do have problems with hardware access and broadband access. Now, there's not only our state, but there's a federal push right now to get broadband for everyone. With our pandemic, Broadband access has been seen equal to electricity needs in the 1930s. And our governments, thankfully, are coming to assist in that. So I'm excited about that. Over time, I think we will get much better with that. And of course, the technology knowledge barriers. Now, that is where we can step in and comfort them and help them every step of the way. So we will need to have better access over time, but I do believe that that's going to come. And there's no question people do like the convenience. Nobody likes to travel to the doctor's office if they don't have to. And because of that convenience and better access that people will have when telemedicine is truly almost everywhere that you can imagine, then, you know, the public is going to demand more of it. I mean, it really, in many areas right now, it's a patient-driven thing. Nobody in most businesses, people don't like change from our standpoint, but actually it's the users who are driving the change right now. And there are a lot of misperceptions as far as providers right now that there is no interest in the elderly. Actually, there are some studies looking at and have shown that there is a lot of interest in the elderly, amongst the elderly, in doing these types of visits. There's fear about it because they don't understand the technology, but they do know that if they could get to see a provider sooner without having to travel, that is a win. And so there is interest in it. It really is dependent upon us to be able to show them the way to do it, okay? So as far as a few other technology facts, 7 in 10 elderly folks do have a computer, smartphone, or a tablet and have internet access. So that's the biggest piece of your hurdle right there. The next part is just showing them how to use it and getting them comfortable with it. Because right now, only about 11% of the elderly in studies feel comfortable with starting off for the first time on a telemedicine visit. So the benefits of caring for the elderly include, there's a long list here, you know, easier and faster access to various medical services. They can remotely do this. They can look at all of their health records and keep up with when things are due. You know, we actually have a health maintenance section in our charting system that patients can see on their portal. So they're always looking on there and then messaging me, "Doc, I see I'm due for my mammogram," or whatever, you know, and so they actually keep up with that type of stuff. There are smooth and rapid help in emergency cases. You know, a patient with an active portal access can look at their chart no matter where they are. Another state, they can pull their chart up, and if it's an emergency situation, that could mean a very big deal with how someone would manage their care. It saves time and money for patients without question. If they don't have to travel 60 miles, you know, to go to a physician to be cared for, that saves them. The feeling of security and staying in their friendly home environment. Think about that. You know, if they don't have to travel and go through all the traffic, et cetera, wait in our lobbies and then check their blood pressure, you know, because they're feeling a lot safer in their own home, then that is good. And there are some studies I've read about people being more open and talking more freely about their issues and their problems and giving better histories when they are within their own homes and feeling more comfortable. It gives them a feeling of independence, of being under some constant medical supervision. So this is with respect to when we're using monitoring type devices, blood pressure cuffs and glucometers, and then tracking that and helping them manage their numbers. So that gives them some better control and feeling that they are being supervised better. And then greater awareness of their health state, both with prevention, diagnosis, and treatment of their disease. And of course, improving their quality of life and decreasing their burden of care. You know, sometimes they have to get family members to come and bring them to the doctor, et cetera. So that is a burden on them. And then, of course, there's educational benefits. Personally, I send out some educational information to some of my patients when they have certain issues, and I'm able to transmit all of that to them through our portal. Now, some of the barriers for actually providers historically and for patients has been reimbursement. There was a fear that, it wouldn't be covered. Well, COVID's pretty much blown that out of the water. Pretty much everyone's covering that right now. We don't know for how long, because that could change at some point, but at this point, it is not a big deal. There is, amongst providers, misperceptions of the interest of patients that I told you about earlier. And there definitely is a lack of telehealth training. We still have a lot to do to get people to feel comfortable with it. Many of our telehealth platforms are not accounting for the needs or the specific needs of elderly patients. I'll go through some of that when we go through some of the accommodations that we can make for these patients. And there is some resistance to using any kind of new information technology. There's a lack of knowledge and awareness of the availability. So some people may not even know that their providers do telemedicine type visits. And of course, for those folks who don't have a computer, there is a high cost involved if they had to get one. There's a strong need for direct contact with the doctor and other health professionals. A lot of times, that's a barrier. And then you can have some cognitive decline in some patients that they just mentally may not be able to do it. We talked about the fear of loss of privacy with that, so that's a barrier. And then there are some legal regulations where there's a lack of legal regulations within state medical societies for some states, although Louisiana has really come along quite nicely, especially since COVID. One barrier, or a big barrier for some, is actually some sensory changes and motor changes that can occur in the elderly because of their vision, hearing, touch perception, or mobility issues. And of course, balance and light perception. All of these things can actually affect their ability to maybe see a screen or see something that you're showing them on a screen. As a 55-year-old, I've talked about this before, with progressive lenses now, I kind of have to hold my head in a certain position to see some of the print on a screen. So for all you millennials out there, this isn't a big deal for you, but when you're getting a little older, it becomes a bigger deal. And of course, there's some glare problems and acuity problems, and sometimes even focus problems when you're talking to the very elderly. Background noise can be an issue. So obviously one of your accommodations needs to be that you should be in a quiet area so that someone who may be a little hard of hearing can discern just your voice. Ringing in the ears for patients can be an issue, especially if they don't know how to work their volume controls on the computer to get the sound up, on the speakers. And then muscle strength and tones can sometimes be an issue. It may be hard for them to manipulate some of the buttons. They may have a tremor, things like that, all of those things can affect their ability to actually manipulate the hardware and of course make the software work appropriately. So some of the other cognitive effects can be just their slowed speed of processing. When you talk to some elderly folks, it takes them a little time to understand what you said and then go and move on to do the next thing that you need them to do. And of course, multitasking can be a little difficult. And then episodic memory, actually remembering when their appointment should have been and logging in at an appropriate time, and then reasoning and problem solving can all affect their ability to have a good visit with you. So accommodations that you can think about implementing and using is that even with mild cognitive impairment, sometimes it's hard for people to remember when they have a visit scheduled. So when they schedule their appointment, asking them to write a note and put it on their refrigerator, or having something visual to clue them in. And if they do have an ability, or one of their family members has an ability to set a reminder for them, either with a clock or on their computer or something like that, to be able to clue them into that it's time to do something. And that may need to go as far as one of their family members calling them right before the visit and reminding them to log into their visit. And of course, it may ultimately need to have a caregiver to help them, one of their family members or friends that can help them get into the visit and navigate that visit. I always, when someone says, oh, I could never do that, then this opens the door for me to really start talking about some of their other needs that they need help with. I ask them, so who helps you with your care? It might be who got you to the visit today. And when they start talking about, well, it was my daughter who helped me. Great. So your daughter's helping you with your care now. I can then ask them, would you mind if I allow them to have access to your chart online so that we all can be on the same page with your care? And I talk about how, sometimes we need you to have some things done, and it's a little difficult for us to talk about that with you over the phone and have you understand. But it would be great if I could have that written out for your daughter and them see that online and then get you what you need. I mean, I can't even remember the last time someone declined to do that. So people know when they're getting help and know when they need help. And I think it would be a rarity for someone to say no when someone is truly helping them with their healthcare. So I would encourage you to utilize that, because it's been very successful for me to get the folks who are elderly and initially are resistant to using an online presence. All of a sudden, I can turn it into a big win and get them online so that I really can interface with the people who are really helping them make their decisions in their life about their health. So I also often talk about end of life issues. When it's to that point that they're needing, that kind of help, it's a great door that's already now opened, and I can talk about end of life issues with them too and get those particular types of paperwork signed to help them with their care. So some strategies that I teach our folks is don't assume disinterest in the elderly, first of all. And if they express disinterest, then open the door for, well, who's helping you? I try to meet them where they are. There are, especially with COVID now, that we do have some telephone visits that we can do. If it's just not going down the right path, that they're very resistant, or they don't even have the hardware to be able to do what we need to do, then meet them where they are. Then try to help them with their care and making it easier for them. I do discuss the pros and cons with patients, especially with, not having to travel and wait on me, and appointments are a lot sooner oftentimes. They can understand that, and that's a big win for them. And I do always tell them, we'll have some bumps in the road, but we'll figure it out. This is a new technology, and I have explained to them that I'm trying to work out the kinks in it too, but they can help me make it better for the next person. And that's always a good way of dealing with. And I talk about our successes. Especially really my nurses talk more about the successes, because a lot of times when a patient is trying to decide about even scheduling an appointment with me for a telemedicine visit, the nurse can then say, I've seen the doctor treat these types of problems before, and people really get their issues cared for. So that gives the patient some third-party validation that, yes, we can do this in this manner. I've seen it work before, and that gives them a comfort level to go ahead and schedule that out. We have our folks who we know it's difficult sometimes for them to get in or even remember, and I have my staff call and just clue them in. Hey, it's time. It's going to be time for your visit. Do you need help getting into that telemedicine visit? And one thing that's really nice is when I can share the screen. Our software now allows us to be able to share our screen with patients. So, a picture's worth 1,000 words. So if I'm trying to explain something to someone, being able to flip my screen to them on their screen and show them what I'm looking at and describe something, man, it really helps out in them being able to feel like, they really got something and some understanding out of the visit. So up front, when we do our scheduling for the visits, the patients actually receive some instructions on, how the appointment is set up, how to get into the appointment, etc. And with the elderly, especially, using very concise language in larger font is a big help. So try to do that and include some screenshots of exactly what the screen looks like when they go to one particular field, and maybe have a pointer to the button they need to click on. So that really helps them understand what they need to do next. And then instructing them on volume and the lighting of the screen itself. Teaching them how to do that can sometimes be beneficial for them to overcome some of the visual and audio issues that they may have if they're hard of hearing or it's difficult for them to see. And then, of course, if you're presenting yourself, it helps to be, with a neutral background behind you. Again, so if they have any visual issues, it makes it a little more clear for them to see you or whatever you're showing them. And of course, being in a very quiet area where there's no background noise, we should be doing that anyway. That's just a good thing to do no matter who you're seeing. So as far as best practices, we just kind of went through a few of those. You try to talk also about them positioning their monitor or their phone that they're using so they reduce any strain or pain that they may have if you see them straining to look at the screen and things like that. And at the end of the visit, it's very important. This is whether they're seeing you in the clinic or telemedicine, but I think more especially with telemedicine, because you want to make sure they understand what you're talking about, providing them with the instructions. And for instance, in our program, the after visit summary that we always hand to them after their visit in the clinic, it actually is on their portal. So they can see that entire thing. And I'm able to drop in, for instance, exercises or diet sheets and things like that. I can include all of those in my after visit summary, and it actually shows where their medications were sent and labs that they are needing to get done. So if you're designing out your after visit summary, you want to make it such that it will have all of these things in there. Again, if it's for the elderly, in large font to be able to make it easier for them to see. Now, if you are seeing some newer folks, if they're new and they're elderly, it's going to be, a little bit of a challenge because you also have to establish that rapport with them. Okay, first of all. And so I up front try to acknowledge that this is going to be kind of weird. This isn't like, your normal visit, and it's going to feel a little weird to start off with, but we'll make it good for you. And so in some of our other presentations, we've gone through ways to make people feel comfortable with your visits, like looking into the camera and not really looking at the screen, because when you look at the camera, you're looking at them in their eyes. And then that second part of reassuring them that we will be able to take care of their problems. And if we can't, we'll need to see them. That's okay. But assure them that you will help them through that. And of course, I have all my staff clued into that too, because they are the first people who are going to be seeing them. I talked about looking at directly at the camera. That's just like you would be doing in person. And then clarifying any information that you teach them about or tell them about, and then ask them to repeat that back. It's hard for someone to repeat something back and not understand it to begin with. So I try to utilize that and make sure that they understand what I would like for them to do or what I've diagnosed them with. And then, of course, the biggie is always using empathic language. If you've never met anyone in their life and you use that and you meet them where they are, there's no way that you can't establish a good rapport with people. And as we've talked about in some other our value metrics lecture, we talked about how establishing that rapport and having some empathic language is truly what helps drive their patient activation scores and drives them to do the things that you're asking them to do to get better, and it drives outcomes. So I'm going to talk a little bit about assistive living technologies, and these are all things that you know about already, but maybe didn't really think of telemedicine. But when you think of alarm buttons that allows a patient to be able to connect with EMS, it is part of getting them into the health system when they have a huge need, when they've fallen or when they have an acute need. There are now GPS transmitters. This is mostly used for folks with mental decline, for in case they were to, leave or escape a facility or be a wandering type with dementia, then this is very helpful for those. And then there are alarm sensors, the fire alarm, smoke alarms, gas alarms, flood protection, et cetera. And the flood is often, I was like, well, flood, everybody knows when a storm's coming. It's more for like in the bathroom, the water is overflowing and things like that, which can be a fall hazard, et cetera. And then motion detectors in particular rooms and things like that. And of course, pairing all of that up with communication devices to be able to communicate with the patient is very helpful. And then some solutions that help older folks prolong their independent life include including some of the other things are like looking at sleep patterns, observing their behavior, within their home, adherence to their medication regimens. So I presented once on technologies where there are actual electronic pill dispensers that put the medicine out and notify the patients it's time to take your medication. And that actually sends information to their caregivers, their family, make sure that they're taking their pills. There are ways to check caloric intake to make sure that people are eating appropriately. And of course, monitoring vital signs with blood pressures, glucometers, et cetera. So I wanted to share, with some of these assistive technologies, within our own family, we have an elderly family member who is currently 89 years old and still lives alone. She has, of course, we have some video monitoring capabilities that she wanted to have in the home where we can keep an eye on her in various rooms. Actually, those video monitors allow two-way communication. We're able to actually, through that monitor, speak with her. And, she lives almost 2 hours from us, but we can at a moment's notice know what's happening. She also has a pendant for in case she has an acute need. That pendant also has fall detection within it. So if she were to fall, or when she does, because she has actually fallen, it immediately goes to a central device in the home, which sends information out to a communication team. So this is kind of a little slide looking at, in the top corner, you have the patient. And now that we have Wi-Fi capability and computers and all these types of things, these can wirelessly connect all of these assistive technologies that we have. Both a lot of these on the top right are like vital signs and things like that. But those can also include these fall monitors and things like that. So if you look down on the right side, through the internet, that is able to connect with emergency care. For instance, when someone falls, that gets help to them immediately. And then that can connect in with the caregivers. You have ways to be able to connect online with them, do a telemedicine visit if need be. And of course, over on the left-hand side, you have the health center that has the monitoring group, whether that be a hospital or a company that's monitoring all of this data to assist the patient when they need. So that's kind of the state of affairs of where we are right now to help elderly folks in their medical needs distantly. And that's all part of a telemedicine program. So now we're going to delve into some of the pediatric patient considerations. As far as of May of 2020, 12.9% of pediatricians indicated that they had used telehealth in the past 12 months, before that. And then 6.4% had reported that they had referred patients for telehealth during that same time frame. And 15.2% had actually used some type of telemedicine. So the first 12.9% were folks that had actually done telemedicine visits. The others were all of these other technologies that we're talking about, or different types of telemedicine visits, monitoring, and things like that. Okay. As far as move forward to March of 2021, some common visits that are now used or seen through telemedicine visits in pediatrics include a lot of behavioral and mental health issues, especially since the uptick in all of those in the pediatric world due to COVID, that has tremendously skyrocketed. And then, of course, sick visits for colds and rashes and things like that, and follow-ups for particular medical problems that patients may have seen a doctor in the office for, but they needed a follow-up, and instead of bringing them in and having them exposed to potential COVID in a physician's clinic, they would follow up, through a telemedicine visit. Of course, chronic medical problems has had an increase in utilization in the pediatric world, just like in the adult world. Most telemedicine visits tend to be pretty efficient for patients, and I know in my experience, it's usually a one problem issue that we're dealing with. These last usually 10 to 20 minutes, and greater than 60% of respondents report that patients find telemedicine easy to use in this age group, okay? And 59% use a mobile app on their smartphone for telemedicine visits. Actually, the smartphone, there's almost no disparity between different races and almost age groups with respect to smartphone usage and having access. So I really encourage you to look at that. People have more smartphones than they do computers and tablets. So if you're looking for a program, you want to definitely focus on being able to provide telemedicine through that kind of a portal. And patient demand right now is the #1 factor driving the increased use of this. People want it, and people are demanding it, and they don't want to go to the doctor's office as much anymore. And now that they know that they can do it. So that's, again, another reason why everyone needs to try and implement this in their practice. And the top features that clinicians desire in a telemedicine platform right now, especially in the pediatric world, include being able to integrate some peripheral devices that we've talked about, translation services during the visits, and of course, documenting in multiple languages and presenting in multiple languages currently. So those are some of the perks they look for besides the regular bells and whistles. So I wanted to talk about, as far as well care itself, there are things that you can see in a home telemedicine visit that you just can't understand when you're doing an office visit. So some areas that you can look at is nutrition. You can observe, for instance, with infants, you can observe feeding infants, visualizing where the child eats, and look at their pantry and refrigerator. So especially if you were dealing with someone with a nutritional problem or obesity, this would be great to be able to point out various things and do some educational training. As far as exercise, you can visualize the space and activities that children have to play in and look for safety issues that may be present. As far as sleep, for the infants, you can visualize their location to ensure their safety. And for older children, you can visualize their bedroom to address any elements that might affect their sleep hygiene. Lots of kids are using their tablets and their phones in their bedroom at night, and they don't go to bed. I know that happens in my own family, so we've had to pull the phones out the room. But you can look for those different things that may make it difficult for some kids to get enough sleep and then attend the next day at school. As far as the home, you look for an adequate space for the family members to attend, for instance, school and or work, if they are doing that. And of course, in the neighborhood environment, are there any opportunities for socially distant play outdoors during this COVID time? So I found this right here. You're going to want to look at these in detail. I'm going to actually stop the share of this right now and see if I can show these particular templates, so to speak. These were developed by Stanford, and these are guidelines to be able to do a full physical and the things that you can document through a telemedicine visit. For instance, this is for toddlers. And at the very top of this, you look at the priorities for the visit. You go through some history issues and nutrition and things like that, their social environment, and then page
Dr.
2 of,
Hudspeth,
yes.
we don't see your screen.
Oh, thank you. I'm so sorry. I didn't go back and share that part. Let me get back out. I'm going to end the share on that one, and then sorry about that. I couldn't pull it into the actual presentation, so made it a little difficult. All right, I'm gonna go to screen share again, and then I'm gonna just do the whole desktop so I can pull it up for you. All right, can you see it now?
Yes.
Okay, sorry about that. So on this top part, you can see this is the telehealth well child guidance for toddlers. And I was talking about, it goes through a full history of everything you can do, which you can do that through any kind of a visit. But then this is a gold mine for folks who are doing this, to be able to know what can you see and document in a telemedicine visit. And why it's such a big deal. You know, one of the main issues that pediatricians complain about or don't want to do a telemedicine type practice is because they fear not being able to get the right kind of physical data to make decisions. Okay. And that's why I thought that this was such a big deal to be able to find. So let's see, can you see this next group? This is the 4 to 5-year-old. Are you seeing that one?
Yes.
Okay. So this is the 4 to 5 year age group. This is actually the top of the page, with all the history part. And then page 2, here's all the physical components. And again, that's just a big deal that I think would allay the fears of most pediatricians who are fearful really of doing this type of a practice. So I encourage you to go to this particular page. It's page 36 in the presentation. And all of these links go directly to those particular pages. Stanford developed these, and I can't wait to share them with my own team. So, all right, let's see. Are you seeing the screen again with the presentation?
Yes, we are.
Beautiful. Okay. So next, I want to go through a few things with specific problems in pediatric patients. So asthma care, first of all, when documenting on these folks, you're looking for reducing their impairment over time and the risk of future attacks. So identifying the specific patient questions and documenting those is important. Of course, assessing their severity and or control. So you're looking at, how many times do they use their rescue inhaler and things like that. And then confirming their spacer use and technique. And that's something that they should have their medication in their home, and you can see how they use their inhaler, which is very important as far as compliance. We can complete an asthma action plan and then send that to the patient and share that. They can share that with their school. We can confirm immunizations and schedule follow-ups on this to be able to document what they're doing and how they're doing it, and actually if anything's changed as far as improvement in their utilization of their medications. In looking at pediatric ADHD, we try to look at the 4 primary modalities of behavioral therapy with counseling, educational programs on, how to better study and things like that, and then look at their diet and sleep and screen time. Again, you can look at their room and you can talk about the things.
I couldn't hear what you said.
You can look at the things that they're doing in the home at the time, okay? And of course, you can go through their medications. It is important for you to be able to document vital signs if you're giving ADHD medications. Important in that is, of course, blood pressure and pulse. Those are things that we track. You need to have that on this type of visit. And of course, in children, you need to be documenting weight and height. And those are things that can be measured in the home and relayed to you and then documented. Of course, the date of the medications, when basically in your history, you're always trying to put the date of the medications, how long you have them on it. You give 3 months at a time. You have to document the P that you looked at the PMP, the state database, and then assessing for any side effects and concerns and things like that. And of course, their nutrition and activity, and you can do some cursory physical exam on them. And then in mental health, you can discuss items with the parent, with them present. You need to be able to also ask if the patient would like to have some individual time and try to be able to have some confidential time with the patient in a pediatric practice. You can advise them on having a set of headphones or being in a separate room to be able to have that private time, and then allowing flexibility during the visit to be able to, have someone, maybe an older person with them, and then time without the other person, because, this is actually becoming a big issue right now with respect to sharing notes and sharing labs, etc. There are specific laws on the books that protect patients, even if they are a minor, if they want to have privacy for these certain things. And if you do have worries about privacy with a patient, then you can designate a special word or sign that they can say that if all of a sudden during the visit they don't feel comfortable that they are private, that they could share that word or that sign, and you would know that you need to continue that conversation at a different time. So, it's kind of hard when you really have a big telemedicine practice. People will have a visit in the darndest places. I had one actually last week. The patient was in a dentist's lobby with other patients around when the patient logged on to the visit. So I had to have a conversation. You're around a lot of people. Does that matter to you? Well, it did not matter to her, but it was the onus was on me to make sure that was with her approval, that we start doing that, and that she had even thought about it. And she had, so it all worked out. Of course, with the mental health visit priorities, I'm trying to collect family and social history, et cetera, from them. And with COVID, assessing how COVID has affected them at this particular time, because it's such a big deal right now. And then, of course, after the discussion of the management plan, I include, information about where we may refer to or medications we may use. And of course, all that's documented. With respect to pediatric obesity, there are some special considerations there. And these basic 4 components are identifying that they, where they are on the BMI charts. And those are things that is very helpful to be able to share a screen with them and show them where they are. You consider working up other entities like genetics and environment and things like that that can be beneficial. This is especially good in a telemedicine visit, where you can actually ask them to look in their pantry and see the things that they commonly eat. So that may be helpful in helping them. And of course, evaluation for other health consequences. So trying to get them to do things like vital signs and such as that to see if they're already hypertensive at a young age is important. And then, of course, documenting any treatment that you may give. I'm not going to go through all of these things, but this is additional things that you can add in your obesity evaluations and treatments. And these are some great resources for obese pediatric patients that I thought I might include for you to be able to go to and help people with their problem. So as far as specific guidelines, there's a group called the American Telemedicine Association, and they do have basically some operating procedures and recommendations for pediatric telehealth. And the big topics that they cover in this is patient privacy and confidentiality, which we went through a little bit just now. Of course, patient safety, the clinical encounter and how you should document that up front, and then also legal and regulatory considerations. And actually, if you click on the link, click on the icon right here with American Telemedicine, it'll carry you into all of those guidelines, and you can see those. So they're pretty helpful and extensive. They can really help you out in understanding specific things that you really need to look at if you're treating a lot of pediatric patients. In those, they want you to look at your own state regulations and make sure you comply with those, and in addition, your federal regulations. And they provide some policies and safeguards to protect patient privacy. So we discussed that a little bit a minute ago. You need to have a plan in place. If the patient doesn't feel that they are private anymore, they can have a sign to you if the visit is being compromised. And then, of course, if recorded, you have to disclose that to them, and you must be able to provide a copy of that to them if they ever should want to have a copy of that. And if they transmit any kind of data to you, such as, a picture of something, that is not something that can go through a text or an email. That is not HIPAA compliant. So you must, make sure that anytime you're asking for that type of documentation from them, that you provide a secure way for them to be able to transmit that to you. Of course, just like any other visit, they have to consent to the visit prior to it. And there are some laws on the books about age of consent that are general guidelines, but I'll present you our own state's regulations in a second. Of course, you have to be able to verify that a patient is who they say they are to the best of your ability. And then, of course, emergency services. If you have someone that is sick, and this is in any type of visit, you should say, if we get cut off and you are having these things going on, your nearest emergency room is thus and such. Okay, so having those things pre-said is a regulatory type thing that you need to be able to do and document. Telling them that if I can't reach you through a telemedicine visit, I will call you back on the phone. Just having those things set up as far as what would you do if things are not doing well. Of course, informed consent if you are going through school services. Actually, there are some laws that protect schools, and when you are doing specific work through a school, there are certain laws that protect you in being able to care for patients through that particular entity. And of course, if there's an abuse issue, you have total reign over that, and being able to, and you're forced to take specific steps to take care of that patient in specific manners. And that's no different than when you're seeing them in a clinic. This is obviously wordy, but I really wanted to go through this particular thing right here. This is Louisiana's. This is out of our Louisiana Medical Society, Louisiana, where we get our licenses from, right? Louisiana minors' consent to medical treatment and related procedure, subpart A, minors' consent. This needs clarification amongst a lot of institutions right now, because we recently had something called the Cures Act. And with the Cures Act, that means that all lab testing, et cetera, it's mandated by federal law that those labs dump into any portal or their online access, if they have it, immediately before the provider gets a chance to see it. It's in their portal. So who does that get shared with? So obviously that is information that your institution has to make a decision on. How do you manage that type of data? Well, as far as the visit goes, there are some laws that govern that. So I'm going to just look at the highlighted area. When executed by a minor who is or believes himself to be afflicted with an illness or disease, shall be valid and binding as if the minor had achieved his majority. That means if a child presents to you, then you have the authority to treat them. Okay. Now, historically, a kid probably couldn't get to your office if the parent or someone that could drive could get them there. But this new world of having telemedicine capabilities, all you need is an iPhone, or a computer, and you can log on to an appointment. So I can see where in the future, this might be a big issue for someone. If you are a provider and all of a sudden a 14-year-old logs on to a visit, what are you going to do? Well, this is telling you what you have the authority to do. You have the authority to treat them according to our current statutes. Part B here. The consent of a spouse, parent, guardian, or any other person standing in a fiduciary capacity to the minor shall not be necessary in order to authorize such hospital care or services, or medical or surgical care or services, or administration of drugs to be provided by a physician licensed to practice medicine to such a minor. Okay. Part C. A physician or member of a medical staff may, but shall not be obligated to, inform the spouse, parent, or guardian of any such minor as to the treatment given or needed, and such information may be given to or withheld from the spouse, parent, or guardian without the consent and over the express objection of the minor. So this particular statute really is giving the provider the authority to inform or not inform a parent. I mean, you just talk about, in this case, say a parent, okay? It is really incumbent upon the physician or provider to do what they think is right. So this is another big thing that, that you may have to hang your hat on one day. And lastly, no hospital and no physician licensed to practice medicine in this state shall incur civil or criminal liability in connection with any examination, diagnosis, and treatment authorized by this section, except for negligence. Okay, that means you cannot be sued for caring for a minor in this particular situation, unless if you're negligent. Obviously, if you do something that's malpractice, you can be sued, but not for the sheer fact of caring for someone. So as we move into the new world, obviously there are going to be sticky situations, and we're going to have to deal with these over time. So patient safety, this is another thing that that group looked at and advises on. Of course, it's the same as in person. And of course, it's best if you have parent and legal representation presence. But of course, as we talked about, if you feel, if the patient presents to you and doesn't have that, you have the authorization to treat. You always want to have some emergency contingencies. And of course, on mobile devices, it needs to be provided through a HIPAA compliant program. That's not FaceTime, okay? So you need to be using a HIPAA compliant thing. As far as physician experiences, attitudes, and challenges, I'm going to breeze through these really quickly. As I told you earlier, a lot of pediatricians, they really worry about being able to do an adequate exam to be able to make a diagnosis. Obviously, it's difficult. You cannot look in an ear, when someone's complaining of an earache. But just like in adult medicine, we can't care for 100% of things, but there's a whole lot of stuff we can care for. And in the pediatric world. So you just have to kind of sift through your practice and determine the things that you feel like you can adequately treat, and then use some of these tools to be able to do that. I'm going to kind of go through a few things here on that particular topic, because I did want to cover some of the information for deaf and hard of hearing patients. So there are accessibility solutions. There are various things that people who are hard of hearing can utilize to be able to connect with people via the telephone and things like that. And there are basically 4 possibilities that a patient can go through. One is a remote interpreting service on the same screen or platform that allows for the direct participation of a qualified interpreter or transliterator, they call it. Okay. So this is someone, in the visit at the same time, and basically like a 3-way FaceTime call, but not in FaceTime because FaceTime is not technically HIPAA compliant. But many platforms do allow someone else to interface in on the visit. There are communication access real-time translations that can be done. And this is on the same screen or platform and allows the captioner to caption the screen. So basically they're typing that out back and forth between the two. And then the use of accessibility services such as remote interpreting and captioning on a different screen or device. So some folks actually have these type of services to do other things, you know, banking, et cetera. I mean, they can do all of these types of things too. And then use of other accessibility services on a separate screen or platform, such as relay services. So it is incumbent upon the patient to instruct the healthcare provider which one of these services that they will use. And then, you know, you should be able to provide the service through that method. Okay, so that's kind of the two steps that you kind of have to go through in providing some accessibility. And there's an organization called the National Association of the Deaf and Deaf Seniors of America. And there are some resources there where you can actually, you know, look up that can be helpful to you. And it's actually that group that fosters the appropriate provisions for these types of patients. And they you know, work on their behalf to try to make sure that folks are doing the right thing and making it where patients can get their care that they need. So this was a good site that I found. And of course, there's a little video there about remote interpreting guidelines for healthcare providers. And that's the link that's provided for that. The last page on resources, there were some important links that I thought would be helpful to people about Medicaid benefits in telemedicine that may help some folks. And of course, the Centers for Medicare and Medicaid Services and State Medicaid, or the CHIP program, telehealth toolkit. So if you are providing services to those types of programs to begin with, this is their documentation on how you can implement that in your own practice and be remunerated for that. Of course, we have a long list of other resources that we've built over time in all of our presentations. And this last page is the contact information to be able to connect with Danae and her team at wellahead@la.gov. Of course, all of these presentations will be posted at the walpen.org/telehealth site, where you can view them all, download all of the PowerPoint presentations. And then of course, you can always connect with me at my email or online on Facebook. So are there any questions?
All right, thanks, Dr. Hudspeth. We are just a couple minutes over, but we can hang out. If you guys have questions, we're not in a hurry. We're happy to answer those. So we'll just give it a minute, see if any questions come in. We don't have any at this time. So we'll just wait just a minute, see if any come in. We want to make sure that we can answer your questions.
You know, every time I've been putting one of these together, it's so much information. You know, and then to drill that down, man, we could have had several presentations on special considerations, you know, but, you know, picking the elderly and the PEDS patients, there are some special needs there that you need to kind of think about to be able to get them on, and especially right now with the elderly, because that segment of the population is going to explode even more, and those are the ones who truly have a greater need for healthcare, and it's often harder for them to get to a provider. So just think that you know, gearing your practice, if you're not a pediatrician, gearing your practice to really facilitate the visits and make it easier for them, it's going to make it easier for everybody. So
definitely. I remember those statistics about the elder population growing exponentially over time. We looked at those a lot when I was in school, because they're like, this is where healthcare is going, is this chronic disease management and all of these things, because that's the population.
Sure. Sure.
So, all right, I'm not seeing any questions in the Q&A box. So we will go ahead and wrap up today. Thanks so much for joining us. Again, the slides will be on our website at walpin.org/telehealth. There's also a form on the bottom of that page where you can submit any questions that you might have about this presentation, any other presentations in the webinar series, anything else about telehealth, you can submit them there. Those will end up with me and we'll make sure that we get you taken care of. Again, this is our last live session of this series. We really hope that you've enjoyed this series and you found it really valuable. And I do want to give a huge thank you to Dr. Hudspeth for sharing his expertise and many hours of his time with us. You've been such a wonderful partner for this series and we greatly appreciate you, and we hope that you will continue to work with us and we'll keep working on expanding and improving telehealth in Louisiana. So thank you so much.
Thank you for the opportunity.
So it's been wonderful, and thanks everyone again for joining us, and have a wonderful night.
Good night.